The following program is a production of LXI New Media in cooperation with the following physicians and healthcare organizations.
Hello, and welcome to the Indianapolis edition of Modern Healing. I'm your host, Dr. Alan Shackelford. Thanks for joining us. On this program, we're going to show you some important advances in medical techniques and technologies. We'll introduce you to some of Indianapolis's acknowledged specialists whom you can contact for more information, and we hope this show will give you the kind of vital, up-to-date information that could really make a difference in your life. So sit back, unwind, and learn as we enter the world of modern healing.
First on Modern Healing, Indianapolis Neurosurgical Group.
Back pain affects about 90% of adults at some point in their lives, and about 67% of adults experience neck pain. Back and neck pain are among the most common reasons for doctor visits. You know how unbearable pain can be. Pain can greatly lower the quality of your life. In fact, some experts call this problem America's hidden epidemic.
About 7 years ago, I woke up with this awful pain in my neck. Being a radiology technologist, I knew that I wanted a neurosurgeon for my back because they have the expertise with the spinal cord and the nervous system. I saw Dr. Potts. We decided on surgery, had a great outcome with my surgery with Dr. Potts. A few months ago, I woke up again with pain in my neck. I saw Dr. Potts. We decided at that point, or he decided at that point, that surgery was not an option at this time, so he sent me to pain management to Dr. Wilson, who gave me several options to relieve my pain.
Many people are unaware that there are physicians within the medical community who specialize in the treatment of back and neck pain. When caused by nerve problems, back and neck pain can be treated by a neurosurgeon who has special training in understanding the role that our nerves play in our bodies. They are experts in diagnosing why you have pain and the best way to treat it. In addition, there are doctors with special training in pain medicine who can help treat pain when other options are not possible. Founded in 1970, Indianapolis Neurosurgical Group has a team of neurosurgeons and pain physicians who work together to solve a patient's back and neck issues.
Spine care is constantly evolving. Two of the exciting new facets that we routinely employ at Indianapolis Neurosurgical Group are minimally invasive techniques to deal with complex spinal disorders, and also image guidance to ensure our surgeries are more efficient and safer for the patient.
People suffering from back and neck pain need to know that they have options, that they can be quickly evaluated and then seen by the most appropriate specialist, whether that's a neurosurgeon who treats back and neck pain or a pain management physician.
At Indianapolis Neurosurgical Group, we've developed a screening process for our back and neck pain patients that allows them to be seen quickly, usually within a few days, if not sooner. Patients can feel confident that our specialist will work together to coordinate their care for their individual pain problem.
No one knows your pain like you do. In fact, you're the only person who can tell if your current treatment is effectively controlling your pain. While some people believe that pain is just a part of their condition or that they shouldn't bother their doctor about it, the truth is simple. You don't have to live with severe pain.
I feel great. I have my life back. I'm not laying on the couch watching life go by. I'm able to do all my activities. And I'm just so grateful to the Indianapolis Neurosurgical Group for coming together, everyone coming together to help resolve my pain.
Advances in pain surgery and interventional pain management techniques are helping those with back and neck pain live active, healthy lives again.
Still to come, Cancer Care Group.
Aside from skin cancer, prostate cancer is the most common cancer affecting men in the United States today, and it's the second leading cause of cancer death in men. In 2008, almost 200,000 men were diagnosed with prostate cancer. Thankfully, for most men, prostate cancer is caught early before it's spread to the other parts of the body and is therefore potentially curable with appropriate therapy. Radiation has been used for decades to treat patients with prostate cancer with a high rate of success and can be given in several different forms. One form of radiation, called radiation brachytherapy, is delivered directly to the prostate in the form of implanted radiation. At Community Hospital in Indianapolis, a form of brachytherapy called high-dose rate brachytherapy is available for patients with prostate cancer and is only available at a limited number of hospitals across the country.
The patient's brought to the operating room, placed under anesthesia. Under ultrasound guidance, the needle tracks will be placed in the prostate. Then we get a CAT scan to determine where the radiation would go. Each treatment lasts between 15 to 20 minutes. Most patients get between 2 to 6 treatments. Once the radiation is delivered, the radiation and the needle are removed. Most patients go home that same day.
HDR brachytherapy is a newer technique of treating prostate cancer that delivers a high dose of radiation directly to the prostate. Because the radiation is delivered directly inside the prostate, it limits the amount of radiation surrounding organs receive.
Most patients whose cancer has not spread can have high-dose radiation as part of their treatment. Patients in low-risk group can be treated with high-dose radiation alone.
Radiation brachytherapy for prostate cancer also comes in the form of permanent radiation seed implants. With this form of brachytherapy, small pieces of radioactive metal are directly implanted into the prostate and remain there permanently. At Community Hospital, HDR brachytherapy has replaced standard radiation seed implants for the treatment of prostate cancer.
What stands out in my mind about the Community Cancer Pavilion is the personnel and the way they treated me as not just a number, but I was a patient and I was their patient, and they wanted to take care of me.
Unlike with traditional permanent seed implants, with high-dose rate radiation, there's no radioactivity that the patient goes home with. The radiation's removed before they go home, so there's no radioactive precautions that they have to take when they get home. In addition, because of the way we give the radiation, we can deliver the radiation much more precisely in the prostate compared to traditional permanent seed implants.
At Community Hospital of Indianapolis, you're cared for by one of the most experienced, knowledgeable cancer care teams in the area. They've been performing HDR brachytherapy for over 12 years, and they are a regional referral center for HDR brachytherapy treatment.
High-dose rate radiation offers a less invasive alternative to surgery for prostate cancer. The recovery time is shorter, and the outcomes are at least as good as with surgery. In terms of side effects, the high-dose rate radiation offers the best chance for men to preserve sexual function and maintain bladder control.
Of course, I had the high-dose radiation therapy. There were a couple of treatments that they did on me. Surprisingly, it wasn't very invasive, or it wasn't very painful at all. No pain at all whatsoever. And today I can say I feel very, very good.
Still ahead, Dr. Jack Farr with the Cartilage Restoration Center.
Knee pain is the most common musculoskeletal complaint that brings people to their doctor. Joint pain is not just a part of life or the normal aging process. Cartilage problems are the most common source of knee pain. Over 2 million people in the United States suffer with some type of cartilage problem annually. Fortunately, there are several new treatment options for damaged cartilage, many only recently available. This is the Cartilage Restoration Center of Indiana, founded by Dr. Jack Farr in 1998. It was further developed in conjunction with the Orthopedic Research Foundation and orthopedic surgeons from OrthoIndy. The center's goal is to offer a full range of contemporary treatment options for knee cartilage problems.
Unfortunately, cartilage doesn't heal. Therefore, we need to have treatments to help the body restore the articular cartilage. Currently, we have allograft, we have cell therapy, plugs. Each of these has certain limitations. That's why at the Center for Cartilage Restoration, we're exploring multinational and national cartilage studies looking for a better way to restore patients' cartilage.
As a leader in Indiana cartilage restoration advances, Dr. Farr participates in several ongoing articular and meniscal cartilage clinical trials. These are typically industry-sponsored and FDA-monitored studies, and by participating in these studies, he is consistently looking for the best procedures and devices that will improve the patient's outcomes. Cartilage Restoration Center of Indiana and Dr. Farr are currently enrolling patients who meet the strict criteria for these investigational studies.
Currently, we are recruiting patients who have focal cartilage defects. Focal defects are much like a pothole in the road of the articular cartilage. This unfortunately would exclude those patients with arthritis. However, for those patients that do have focal defects, we have a variety of treatment options, in our multiple investigations. These range from cell therapy to plug therapy to actually implanting a variety of different scaffolds.
Dr. Farr will always explore all possible non-surgical or biologic restoration options first. But if the knee deterioration has passed the point of biologic treatment, Dr. Farr is also a design team surgeon for a new partial knee replacement system. This option allows treatment of one or two compartments of the knee while retaining all the ligaments. However, some patients only qualify for a total knee replacement. And fortunately, there are several of Dr. Farr's partners at OrthoIndy who specialize in this procedure. Dr. Farr and his partners share a single objective, that is, to get you out of pain and back to a normal lifestyle as quickly as possible. If you'd like more information about the Cartilage Restoration Center, or if you miss any of the important numbers shown throughout our program, please call 1-877-674-3285. Our staff will be happy to direct you to the medical professional that could be of particular interest to you. Or you can go to www.modernhealing.tv. Click on the Indianapolis edition link to view all of the medical segments profiled on tonight's show.
Coming up, Dr. Kenny Stahl with South Central OBGYN.
Your choice for a woman's healthcare provider should be a decision that you're comfortable with through all stages of life. South Central OBGYN is dedicated to caring for the health needs of women through all the stages of their lives, from puberty to childbearing years, menopause, and beyond. They have a strong reputation for clinical excellence, and their highly regarded and modern OBGYN practice has provided over 21 years of continuous service to the women of Indianapolis and surrounding areas. Dr. Kenny Stahl has formed a team that is committed to quality health care. Together, they strive to answer all of your questions to help you feel confident in your choice for women's health care.
My practice offers a concierge delivery of complete obstetrical and gynecologic care. It is unique, and it is still a solo practice where the expectant mother can expect her physician to be present both at her prenatal care and delivery. It is also known for its complex, non-invasive surgical approaches, which leaves minimal scarring.
South Central OBGYN and Dr. Stahl are committed to providing diagnosis and treatment of disorders of the female reproductive organs. According to the National Women's Health Resource Center, heavy menstrual bleeding, or menorrhagia, is a serious medical condition that affects almost 20% of women ages 35 to 50. Increasingly, physicians find that heavy bleeding is a common medical condition that patients often ignore. For women with heavy menstrual bleeding, there is a procedure called NovaSure endometrial ablation. This is a procedure that provides an effective and minimally invasive outpatient alternative to hysterectomy, while avoiding the potential side effects and long-term risks of hormone therapy. This quick, simple procedure requires no incisions. It can be performed in an office or outpatient setting and generally takes less than 5 minutes.
The NovaSure procedure is a quick, safe, simple endometrial ablation technique. It uses radio frequency energy to destroy the lining of the endometrium. It takes only one treatment to lighten or eliminate your menstrual periods.
Excellent results have led to very high satisfaction rates, with close to 1 million patients treated. NovaSure has proven safe and successful and has been featured on the daytime talk show The Doctors. According to results of a patient satisfaction survey, 9 out of 10 patients responding were satisfied or very satisfied with the procedure 12 months after treatment, and 95% indicated that they would recommend the NovaSure procedure to a friend. South Central OBGYN and Dr. Stahl provide compassionate and individualized health care to women through a variety of highly competent professionals. They train and continually educate the team to maintain their expertise at the highest standards for women's health care and strive for a personal, consistent touch that will make a difference in their patients' lives.
Still to come, Dr. Stacie Macari with the Carmel Clinic for Functional Medicine.
Functional medicine is a growing field of modern medicine. It is personalized medicine that deals with primary prevention and underlying causes instead of symptoms for serious chronic disease. This approach looks deeper into the problem by looking deeper into the patient. You might say that functional medicine is patient-centered rather than disease-centered like conventional medicine. The practice of functional medicine begins with urine and blood laboratory tests designed to objectively measure your body's internal physiological pathways of tissue repair, immune function, energy production, detoxification, and metabolic signaling. By beginning at the cellular level and working our way up through each pathway, physicians can identify what's not functioning and how to cure the problem at the precise level of dysfunction. To learn more about this specialty, we went to Carmel Clinic for Functional Medicine and talked with board-certified Dr. Stacie Macari.
Functional medicine is anchored by examination of the core clinical imbalances that underlie various disease conditions. These imbalances arise as environmental inputs such as diet, nutrients, exercise, and trauma, and are processed by one's body, mind, and spirit. The core clinical imbalances that arise from malfunctions within this complex system include hormonal, neurotransmitter, digestive, absorptive, and microbiological imbalances. I can incorporate these elements into your treatment plans in order to achieve a level of results that is greater than the sum of its parts.
Dr. Macari has been treating various childhood neurological disorders for many years. She utilizes a biomedical approach to autism, PDD, ADD, ADHD, and other cognitive disturbances not amenable to drug therapy.
What brought me to Carmel Clinic was my son, who has autism, and I've been so fortunate to partner with Dr. Macari, and his progress has been tremendous.
Some of our primary areas of measurement are metabolism of organic, fatty, and amino acids, mitochondrial and cellular capacity, and dysfunction of the digestive tract. We focus on these areas for two reasons. First, these are the core elements regulating the body's ability to control brain function and repair itself. Secondly, these are the areas you can repair in order to restore function.
Another therapy that Dr. Macari utilizes is hyperbaric oxygen therapy. Oxygen has a multitude of effects, including destroying anaerobic bacteria and stimulating the immune system.
To understand how HBO therapy works, you need to understand how your body typically delivers oxygen to your tissues. When tissues are injured, toxic, or overworked, they need much more oxygen than the hemoglobin could ever deliver on its own. This is accomplished by using the pressure to dissolve the oxygen gas into a liquid, which absorbs into the blood itself. In essence, the blood is now flooded with oxygen to be delivered swiftly to every tissue in the body.
We tried for years to treat our boy's autism on our own and got some improvement, but we're so thankful to find Dr. Macari and can't believe the amount of improvement that they've made in the last 12 months and are sure that they are on the road to recovery.
Up next, Dr. Mike Deldar with Advanced Cosmetic Dentistry and TMJ.
The propensity in today's world is to stay healthy and active for as long as possible. This awareness to health includes dental health. People want to keep their good dental health for a lifetime. But there's more involved than just strong, healthy teeth. This segment of our program is dedicated to neuromuscular dentistry. We'd like to introduce you to Dr. Mike Deldar at Advanced Cosmetic Dentistry and TMJ. He will discuss a disorder with symptoms that masquerade as a multitude of other problems, such as sinus headaches, migraines, neck and shoulder stiffness, and earaches. The disorder, craniomandibular dysfunction, or TMJ.
TMJ is commonly known as the temporomandibular joint dysfunction. Is the collective symptoms when the joint, muscle, and the jaw joint doesn't work harmoniously, which create the symptoms like a headache, migraine, shoulder ache, neck pain.
The first step of treatment begins with a thorough examination. Dr. Deldar at Advanced Cosmetic Dentistry and TMJ looks for anything that's going to interfere with the lifelong goal of dental well-being. They evaluate the entire chewing system of each patient.
Evaluation of the TMJ is very important because this evaluation, they give us the idea of relation of the muscle, jaw joint, and the teeth. When this system work in harmonious relation, we can have a beautiful smile and we can keep.
I have suffered for many years from migraines, neck and shoulder pain, and have sought out the help of physicians who have treated me through pain medication. Upon hearing about Advanced Cosmetic Dentistry and Dr. Deldar and his specialties, I have sought out treatment here and have received phenomenal care and have been cured of my headaches and discomfort.
Once you become aware of the cause of your stress, further treatment can involve a variety of techniques.
TMJ treatment through the neuromuscular involved two phases. Phase one, we try to find the right position of the lower jaw by relaxing the muscle, and then evaluate the patient for a few months and keep the patient to make sure all the pain and symptoms goes away. After that period, if the patient choose they want to make the changes permanently, we are able as a restorative dentist to do that by reconstructing their mouth to the right position, or orthodontically move their teeth to the right position, or do the cornoplasty. And some patients, they choose just wear their orthotic at night.
By integrating the patient's needs with the patient's desires, the team at Advanced Cosmetic Dentistry in TMJ customizes a treatment plan to your unique specifications, and they tell us that a healthy joint is the key to keeping your good dental health and your smile for a lifetime.
I had a lot of pain on the right side of my face, severe headaches, shot down all the way through my shoulder, and I was seeking medical attention, and unfortunately all I got was pain medicine, inflammatory medicine. And I went to the website, I found Dr. Derron and the new technology that he uses. I came in and he explained the treatment to me, and I'm looking forward to going through this so I can get rid of this pain and be happy.
Still ahead, American Senior Communities.
Surroundings have a great influence on a person's health and happiness. This fact is especially true for seniors. Where they live, the type of care and companionship available, and the quality of food and recreation they enjoy are all key factors that contribute to health, happiness, and longevity. For a growing number of seniors, continuing care communities have become increasingly popular. These communities, whether it's all on one campus or by partnering with a sister community nearby, offer a lifestyle that perfectly complements their active lifestyle while providing healthcare services should the need arise. American Senior Communities offers a full continuum, including independent garden homes, assisted living apartments, and new energy wellness. Healthcare services include moving forward rehabilitation, memory care, skilled nursing, long-term care, respite, and hospice. When selecting a community, it's important to choose one that offers a wide range of services like American Senior Communities. So as needs change, residents can stay with a company they have come to know and trust.
My doctor recommended Rosegate. He was right. I am happy. Everything here has been great. I haven't wondered for anything, and it's really great to know that if I need any more health care, it is available.
These close-knit neighborhoods of American Senior Communities offer a wide variety of recreational, spiritual, and educational experiences. Residents attend seminars, physical wellness group, and enjoy professional entertainers and concerts.
Because of the programs offered by Augustus Cottages at Scienceville Meadows, Mom is able to enjoy the best possible quality of life right now. They have activities like interactive singing and art projects and family support groups, and all of those things make it possible for Mom and for me to treasure each moment that we do have.
With 21 locations in the greater Indianapolis area and over 44 throughout Indiana, American Senior Communities is redefining life for today's seniors. The service, the setting, the staff, and the innovative vision of an industry leader, it all combines to create an environment and quality of life you have to see to believe. American Senior Communities, so nice to come home to.
It's been a blessing to be at Rosewalk Village with the great therapy department and the great friendly people. Because of them, I am where I'm at today, which is where I want to be, which is back home, where I can do whatever I want to do.
Coming up, Home Instead Senior Care.
Worrying about the needs of an aging loved one while trying to keep up with the needs of your spouse, kids, job, and home can be stressful. You may be taking shortcuts in your own life due to your responsibilities as a caregiver. Your life may be out of balance. You need to feel confident that your loved one is safe in their home. Instead of worry, there's Home Instead Senior Care. Home Instead Senior Care has been providing quality in-home assistance to the seniors in the Indianapolis area for over 10 years. Whether your loved one needs help 24 hours a day or just a few hours a week, your local Home Instead Senior Care office has the expertise to walk you through the process so you can make the right choice for your family. Setting up a free one-on-one consultation allows you to discover a wide range of services, including meal preparation, light housekeeping, medication reminders, shopping, errands, bathing, and grooming. Home Instead Senior Care takes the time to get to know your loved one so they can understand the needs on a personal level. And it doesn't stop there. Home Instead Senior Care takes that extra step to select a caregiver that is perfectly matched to your loved one.
Our mission is to assist our clients in ways that matter to them the most. Our experienced staff create individualized care plans that meet the specific needs of our clients. Our job is to ensure that each client is able to maintain independence with safety and dignity.
Home Instead Senior Care is the world's largest and most trusted provider of comprehensive, non-medical companionship and home care for the elderly. All Home Instead caregivers are dependable, caring professionals who have been thoroughly screened, bonded, and insured. Caregivers are also formally trained to provide personalized care.
Since our clients decide how much they need us, our services are an affordable and practical choice. Our services are flexible because we understand how challenging it can be for families to meet the ever-changing needs of a loved one. Our knowledgeable staff are available 24 hours a day to handle emergencies and schedule changes. We have a long history of quality service, and we do it with care. To us, it's personal.
Home Instead Senior Care understands the needs and desires of their clients. They realize the importance of having the same caregiver assigned to your loved one. Not only does this provide for a lifelong friendship, but it also provides the one-on-one attention loved ones need and deserve.
I know I can't be with Mom all the time, but Home Instead Senior Care gives me peace of mind. She really enjoys her caregiver's visits, and I don't have to worry that she's not eating well or that she's forgetting her medication. Instead, I can relax and just enjoy our time together.
Well, we've given you a lot of information. We hope it's been interesting and will prove helpful. Again, if you missed any important numbers, please call 1-877-674-3285 or go to our website, www.modernhealing.tv, and click on the Indianapolis edition link to view all of the medical segments profiled on tonight's show. For all of us on the program, I'm Dr. Alan Shackelford. Thanks for watching, and please join us next time for the Indianapolis edition of Modern Healing.
Hotel accommodations for Modern Healing provided by Staybridge Suites, Indianapolis-Fishers. Unique in design, unparalleled in service, this all-suite hotel offers fully equipped kitchens in every room, complimentary high-speed internet access, complimentary hot breakfast in the morning, appetizers and beverages during the sundowner reception in the evening. Staybridge Suites caters to both the business and leisure traveler with 24-hour fitness center, oversized indoor pool, jacuzzi, courtyard with 4 gas barbecue grills, convenience store, and business center. The style and beauty you expect from a first-class extended stay hotel. Call 317-577-9500 for your reservations today. The preceding program was a production of LXI New Media in cooperation with the preceding physicians and healthcare organizations.